Hi, everyone. My name is Chris Scappatura. I'm here with Dr. Sharif Ibrahim, and you're here for another episode of Rescuing Your Health. Today, we're going to be talking about heart attacks. As always, before we get the video rolling, Sharif and I have a little discussion about things, and it's fascinating how many people will say, "Oh, I didn't know I was going to have a heart attack. I wasn't aware that it was possible." And I shared with Sharif that recently someone I know, they actually were walking, they were exercising. Sharif, this is a big issue. There's no long tail of, hey, I think I'm going to have a heart attack in 4 days. I better do something. And so let's talk about that first, this whole misconception.
Thank you, Chris. I think this is really a very common problem. And actually, I have seen many patients who have had heart attacks. And when I see them in the clinic afterwards, I ask them three questions. The first question, have you ever thought you're going to have a heart attack? And then everyone said, no, I have never thought about that. It didn't occur to my mind at all. And it's just their bad luck. It's a bad luck that happens and can cause a problem. Nothing like that. So then have you ever thought that you are moving in the direction of having heart attack? And I never had been absolutely healthy. I've been absolutely doing everything that is going to keep me healthy and well and everything. But unfortunately, it happened like that. The third question is, have you ever thought that your heart attack has got anything to do with what you eat and other lifestyle? No, I have never thought about that. Has got nothing to do with that. When you're talking about the heart, then you're talking about which best medicine, which is going to help me to stay healthy and do the best and keep me healthy and keep me well all the time. We're not talking about food here or about other lifestyle. This is really rubbish. And that actually has led me to think most of patients who have gone through this experience, they have gone through it without even having any thought about it. People are not looking for this information because they have never discovered the link between lifestyle and serious diseases like a heart attack.
Now, Sharif, we've been talking for years, and it all comes back to metabolic issues. And for a lot of people, it's still not understood exactly what that means, because you'll have the people, like you said, they're like, oh, it can't be about this, it can't be about that, but it is about the metabolic issues. So let's talk a little bit about what that means again. And we've described this before, but I think it's worthwhile repeating, and then where that stems from, which we know is food. So let's first cover the metabolic and letting them understand what this metabolic issue is and how they can help themselves.
I think this is a very important topic here because when you say the word metabolism, so many people get confused. But it's simply, metabolism is the mechanism that turns food into energy. As we eat every day, this food is the fuel, the body fuel. The process that the body uses to convert this food into energy is called metabolism. So let me just really give you a small little example. If you're going to have really good food and you put this food in your body, and this food is going to be converted into energy to give you vitality and energy and make you happy and active and doing everything you want to do. This is what we want. But actually many people, they take the energy, they take the food, sometimes they eat the best food, and they convert it into not energy. They just take it and they store it in parts of the body as fat. So this is not good. So this is a slow metabolism. The first example is of normal or fast metabolism. And so this is why it's very difficult for people to actually make a connection between the food we eat and the heart disease or heart attack, for example. It's a long way to go from that point up to causing a heart attack. To summarize the problem in few words, it is a big sugar problem encased in a fat capsule. The main problem is a sugar problem. It is our ability to deal with sugar, which is not good. And so we are converting most of this sugar we ingest into fat. So let us just go back again to the sources of energy. The primary source of energy in our bodies is sugar, is glucose. So if we are able to process this glucose the right way, then we are going to win. We are going to have enough energy and everything. But if we are not going to process it rightly, then we are going to run the risk of storing it around. And the whole problem is here. We are going to have, say, fat in our body. We are getting fatter. We are getting overweight. We are getting obese. And we're having, like, a big belly fat, something like that. But we are also fat from inside because we are going to have, say, high triglyceride. We're going to have high cholesterol and the different types of cholesterol. You see the high bad guy and then the high triglyceride, which is really a very bad risk of heart disease. And then low protective one, they call it HDL, which is the good guy. So it is fat from outside and fat from inside, but the problem itself is basically a sugar problem.
And Sharif, that's such an interesting point. Back in my mid 40s, and this is where Sharif was talking about the fat inside, I went to the doctor and I thought it was healthy. And he's, oh, you know what? There's a ward at the hospital full of men that look just like you that have all had heart attacks. And I'm puzzled looking at him, thinking, what's he talking about? Over the next few years, I started to exercise more and make it more of a routine in my life. And I went back years later and he says, oh, you're still in the same situation. And realize it's what I was eating. It was the food that I was creating this metabolic issue that I had fat internally. I had a little bit of a belly, but not all that big. But I was destined to be in that ward with a heart attack if I didn't change my ways, which meant that I had to reduce the amount of sugar that I was taking in. I had to eat, even reducing carbs, not just the candy bars, but all of this to help change my metabolic system inside my body and how I actually created the energy. People should take the time to actually go through a screening process and evaluate themselves. Don't make it somebody else's job to save your life. Sharif, we have a list of things about metabolic screening, talking about lifestyle. And so let's take some time now and talk about even smoking and alcohol and how that affects the metabolic system in our body.
The very important thing is to look if you have got any modifiable risk factor. Because if you have got a family history of heart disease, for example, you see a father, brother, or your son, for example, has got a problem, heart problem, then this is the first degree relative, and that's going to be a big risk of heart disease and heart attack as well. If you have got like a family history of early cardiac death, for example, many families actually have got somebody who died with a heart attack before the age of 45. This is, they call it premature cardiac death. That increases your risk even higher. The inherited issue, we're not going to do anything about them. What we can do is about the modifiable risk factor. If somebody has got like a very high family history, then they should really refrain from smoking if they smoke. They should reduce their alcohol intake if they do, and they should increase their level of physical activity. They should exercise on a daily basis because of this high risk. And then you come to the other risk factors: obesity, overweight, people with high blood pressure. All of them, they are modifiable. So we can really work on all these risk factors and try to reduce them as much as you can. But how can we work on that? So you want to know if you have got too much fat in your body. But here, I'm coming back again to this issue here. We are not talking about the quantity, the amount of fat in your body. But where the fat is stored, this is the most important thing. And the worst area where the fat accumulates is your tummy, the belly fat. If somebody has got high fat storage in their tummy, then they should start reducing all the amount of carbs, which is going to be converted into triglyceride and is going to be converted into fat to be stored around their midsection. So they have to get rid of this fat first. And as Chris said, yes, start by your diet and then start doing a little bit more physical activity or exercise. But the diet is the most important thing. And then you'd like to quantify your risk a little bit more. So for example, somebody might come and say, okay, I'm going to take my weight. But your weight is not going to be helpful because your weight is going to weigh everything. It's going to weigh your fat, your bones, everything, your muscles. That's not really going to be helpful. Unless if you want to compare your weight with your weight when you had been in optimal health. For example, your weight when you were 20-year-old or 25 years old, that's probably in optimal health. And if your weight at that time was 60, for example, and your weight now is 90, oh, yeah, well, let's say 30 kilogram excess body weight. So you have to do something about it. Somebody will say, okay, I do my BMI. Your BMI is okay. But your BMI also is not really very accurate because if you have got, say, too much muscle in the athletes, for example, athletes have got high muscle mass, and that is going to increase their BMI. And so the BMI might not really be accurate. But if you want to push a little bit for something which is going to be helpful, you go for your waist size. And the waist size is really good because it measures your fat storage in your belly. If for a lady, if the waist circumference goes beyond the 35, that is too much. And for a man, if it goes beyond 40, that is too much. And the risk of disease here is too high. So just really, you have to bring them down as much as possible. And that is going to reduce your risk. Somebody might say, I will do waist-hip ratio. The waist-hip ratio is good, but still it might be confusing because you see ladies store fat in the hip area. And by doing that, then the size is going to be high. As I have seen, say, ladies with a waist of 40, but they have what like a hip of bigger than that. And that is going to mask the belly fat accumulation here. So it's better to use your waist height ratio because the height, you cannot really play with that. The height is going to be your height. And the waist, if it's too big and your waist height ratio is over 0.5, then you are in big trouble. Right? So I have to bring that down. And then some people might go a little bit further by checking using the technology, something like the bioimpedance. And that is going to give you a very realistic picture about your body composition. That is going to tell you how much fat and how much muscle and how much bone and everything would be given like a report. And the density scan, DEXA scan. You can use the DEXA scan, which is the scans we use for looking for osteoporosis, which is brittle bones. But the same scan actually can look into your body composition and give you an accurate report about your body composition. Some people might say, what is too much fat? Anything more than 20% in a male is too much. And optimal in a male between 12 and 20. And anything more than 30 in a female is too much. And optimal in female between 20 and 30. It's very simple. You can look at yourself. If you have got too much fat, you can decide, I've got too much risk here. I have to work. I have to work on this, all the modifiable risk factors. Sort them out, including your weight, including everything. And that is going to reduce your risk quite significantly.
Think about how much money you spend on sugar and drinks, whether it's alcohol or whatever form, and you've created this body that now needs to be analyzed. Think of the investment at that point. You spent all this money on food and sugar and all these different things that have created a problem. It is an investment for you to go and get that scan done, then be able to apply the correct plan to be able to reduce your risk of heart attack.
The last point you mentioned is really very interesting. It's very expensive to invest in having a disease than having health. As you said, the amount of money people spend in tobacco or in drinks or the time they waste in smoking and all this stuff, really very expensive. Compared to just say focusing on eating the good food and having say a pair of trainers for going out walking or running. That's really key. We are inviting people to get the knowledge. You can assess your risk very closely, and that can motivate you to adopt the lifestyle which is going to help you reduce your risk. You can just really look into these simple facts, do something about them, and you will be in the best possible optimal health condition.
Great. Thank you, Sharif. Thank you, everyone, for watching, and we look forward to seeing you on the next one. Take care.
Thank you.
Sharif and I appreciate you liking this video, and more importantly, remember to subscribe to this channel. There's a lot of content that we're going to be creating, and we don't want you to miss a single second of it.